This is a pretty typical scenario of something that we see in our combination department. Again, what we refer to as a combo case is any case where we're going to be doing crown and bridge and a partial denture in conjunction with that. So the doctor took a good impression for us, and you can see we've got the prep here, got the tooth that the new crown is going to be made on, and that worked out fine. The problem really comes down to the pickup impression that we need to take for a case like that. So if we look at the model work that's here, you can see that we've marked the rest preparation, the little area where part of the partial denture is going to stop and where it's going to sit. And when we seat the partial denture onto the impression that the doctor took from us, we can see that all of a sudden we have a little issue here. And the issue is that this is not sitting in the rest where it should be. And so and you can see when you look at this too that we've got a huge amount of space between the distal part of this crown and where the partial is, and that the lingual aspect of this clasp is unusually close to the prep itself. It would almost necessitate having a cast gold crown there. You almost couldn't fit a PFM there. And then we have an exceptionally large space over on the buccal as well. So in the laboratory, when our technicians put this partial onto the model, we can see that something shifted. If we look at this side, everything kind of appears to be where it should. It's a little difficult to tell from the detail of the pickup impression and the model that was poured, but it looks like that side of the partial is where it should be when we look at how on the lingual it butts up against the cervical part of that tooth. So it's clear that what happened was this partial shifted this side because the one area of contact, the one area of retention, this crown has been taken off, and so now these clasp arms are floating in space, and there's really nothing to prevent this from rotating to the distal or sliding down a little bit on the palate because of this. And so one of the tricks that I've done over the years to keep this from happening is when I've prepared a tooth like this, I'll put the partial denture into place and I'll verify that, for example, this lingual part is sitting here on the lingual of this tooth where it should be. And oftentimes I will just take some flowable composite and I'll just put a big bulk of flowable composite going from the enamel to the metal itself and then light cure it into place to kind of spot weld this partial into place, because with this crown gone, there's nothing to keep this from rotating. In fact, without the flowable composite, you may even have this partial in the correct position, but when you seat the impression tray over it, the viscosity of the pressure material could be what distorts the partial and kind of pushes it away from the teeth. So you really need a way to kind of spot weld that into place. Now, if there was clasping back here on a molar and it was clasping onto that, you wouldn't have to worry about it. But it's when we've got one area of connection between the partial and the arch on this side that's now been destroyed because we've taken the crown off. We need to make sure we spot weld this so it won't move. But it's not something where we completely have to start from scratch again. So here's what we're going to do. We made a coping for the doctor, and I'll put it onto the model here. And you can see it's a coping that fits on the prep, and you can see the little spikes that we have on there coming out of this casting. And so how this is going to work is we're going to send this back to the doctor with the partial, and we're going to have him cement this coping into place on the tooth with very weak temporary cement. You can put a little Vaseline in there. You could use Duralon and a little Vaseline. Anything you can put on there just to kind of locate this onto the prep so it's going to stay in place. And once the doctor temporarily cemented that onto the prep, he's going to reseat the partial. Now it's going to be in the correct position this time. So when he reseats it, he'll see this lingual part of the partial sitting in this depression, this rest prep, on the lingual of that lateral incisor. And then what we need him to do is somehow connect the clasp to this coping, and we don't want to do it with impression material because we don't want it to move again. So we're going to have the doctor, while he can visually verify that this is seating correctly in the lingual spot here on that lateral incisor, take some cold cure acrylic, almost anything. You could almost use flowable composite, but you can use Snap, Jet, Duralay, and you're actually just going to hook this coping to this clasp. And because it's going to get into the undercuts of these little arms, when we take a pickup impression over this, it's all going to come out as one piece. The weak link will be the temporary cement with the Vaseline that's holding this coping down onto the tooth. So really all we're trying to do is take some acrylic and hook this clasp to this coping that's in place, let it hook onto those arms so that it stays in there when we take the impression. And then we're going to take a full arch pickup impression over this, and then the partial will come out. with the coping locked into place, and he'll send that back to the laboratory. And now we will have a model that we can pour up with the accurate fit of the partial onto the patient's arch and an accurate fit between the clasp and the metal coping itself. This is going to give us the best chance for restorative success when the doctor has the patient back to try in the final crown and the partial itself.